Hi, I'm Dr. Atkins, co-founder of Enjoy Good Health. Vitamin D deficiency is very common, but why should you care? Well, vitamin D levels are essential for bone health, normal immune function, as well as cardiovascular and mental health. What is vitamin D and where can you get it? Well, vitamin D is a fat-soluble vitamin found in limited amounts in certain foods, such as fatty fish, egg yolks, and mushrooms. Foods that are fortified with vitamin D, such as milk, cereal, and orange juice, are also a source of vitamin D. But this is key. It is hard to have normal vitamin D levels solely from the foods you eat. Exposure to sunlight can also produce vitamin D. However, the amount of vitamin D produced from sun exposure depends on factors such as the time of day, season, where you live, and the amount of skin that it's exposed. It takes 20 minutes of sunshine daily with over 40% of your skin exposed without sunscreen to prevent vitamin D deficiency. How do you know if you're vitamin D deficient? Well, your vitamin D level can be checked with a simple blood test. The amount of vitamin D supplementation you need is much easier to determine once we know what your vitamin D level is and whether you've been taking vitamin D supplements when your vitamin D was drawn. Most labs consider your vitamin D level normal if it's above 30 nanograms per milliliter, but we like to have it between 50 and 70 to give you adequate levels for immune health. I see these next two problems over and over in my practice. The first is patients with recurrent sinus infections who are not taking vitamin D, and they hardly ever have normal vitamin D levels. The second problem is patients that are taking vitamin D, but the levels are low when we check their vitamin D. Patients never understand how that can be. Well, occasionally the answer is that they're not taking enough vitamin D. But usually when I ask them what vitamin D they're taking, they say, whatever I can get at the store, meaning the cheapest generic form of vitamin D they could find. The problem with many box store generic or online vitamin D supplements is they're full of fillers. Fillers are things like sawdust that bind to the supplement, in this case vitamin D. When the filler binds with the vitamin D, the combination of the two are not absorbable. When I switch these patients to Enjoy Good Health vitamin D, I usually see their vitamin D levels increase to our preferred level of 50 to 70 within 2 months. That is because Enjoy Good Health vitamins are pure. There are no fillers, no artificial flavors, no artificial colors, and no preservatives. I'm often asked, how much vitamin D should I take? That's a hard question to answer, but here are a few things we know. Vitamin D can be taken daily, weekly, or monthly, but evidence suggests that daily supplementation is most effective. The amount of vitamin D you should take varies depending on your age, gender, health status, and race. It is felt that 2,000 IUs per day is safe and can be taken without the need for monitoring of vitamin D levels. I find that most patients need more than this to get to a vitamin D level of 50 to 70, but if you're going to take more than 2,000 IUs per day, it should be done with monitoring of your vitamin D level by your healthcare provider. Hopefully this has been informative. Remember, take pure vitamins. Take Enjoy Good Health vitamins.